Welcome to the Concussion Fix podcast, where we lift the veil on concussion recovery and empower you with real answers to real questions about persistent concussion symptoms.
Welcome to this week's episode of the Concussion Fix podcast. I'm Nikki and I'm joined with Dr. Hrkal, and today we are going to be talking about sleep and how we can fix our sleep after a concussion.
Mhm.
So we'd love to know, why does a concussion disrupt our sleep to begin with?
Yeah, it's a great question. It's one of the most common symptoms that people get after a concussion. There's research showing up to 70% of people that sustain a TBI have difficulty sleeping, and that happens right away. And then, of course, they're going to be wanting to nap more, and that's going to totally dysregulate what's called their circadian rhythm. Their circadian rhythm, Nikki, is that kind of sleep-wake cycle, and that's regulated by a lot of things in the brain, like neurotransmitters, but mainly by light, and that's the main external kind of regulating source. And of course, after you sustain a concussion, usually people are light sensitive as one of the most common symptoms, so they stay away from light. They have been told, which is a bad idea, as we now know from the latest research, to go into a dark room and put their sunglasses on all the time and stay away from that. So that right away dysregulates your sleep pattern, and which is again called circadian pattern. But then there's also things like inflammation and some of those like electrochemicals in the brain. There's a chemical imbalance, a neurotransmitter balance that also relates to having sleep dysfunction. And so that is another reason that a person might feel more sleepy. Um, we also know that after you sustain concussion, you get kind of this brain hypometabolism, which is a fancy way of saying there's a decrease in energy production inside the brain cells. So your neurons have a lower level of energy production, and that's going to lead to being more tired, more drowsy, and people want to then rest. And then when you're kind of in that state, you might find that you're sleeping a lot more. That usually affects people in the acute phase much more, Nikki. And then after, again, research showing that recovery happens somewhere between 14 and 30 days after the injury. And then if you continue to have symptoms, which one of them could be sleep dysfunction, now you are in the persistent concussion symptom category, or PCS for short. And insomnia and other types of sleep disruptions can continue on. So it's not just insomnia. It could be that you're sleeping too much. It could be that you're waking up and sleeping at the wrong times during the day, and then you're up during the night. There can be even sleep apnea that happens, which is the obstruction of breathing, and that can lead to things like morning fatigue. So there's definitely a huge impact after a concussion on sleep. Sometimes it resolves, but in the cases of PCS, it continues.
And so I always remember you would hear someone has a concussion. Okay, you need to make sure you wake them up like I don't remember what the times were always thrown out there, 30 minutes, hour, 2 hours, something like that. Is that something that people still need to do? Is that a myth that's been busted? Can you talk a bit about that?
Yeah, I remember being told when I was playing, varsity sports that, if you do sustain a traumatic brain injury, this is kind of the protocol. Well, it's important to understand there's a big difference between what's known as MTBI, or a mild traumatic brain injury, or also known as a concussion, comparatively to a severe brain injury. I think what you're referring to here is when a person has a moderate or severe brain injury, they're usually hospitalized, and maybe even before they're hospitalized, when they're still trying to is there the serious condition of, let's say, like a brain bleed? That's when the whole let's wake them up to make sure that they're able to be woken up. That really applies only to very serious head injuries. And if that's that serious, they should be going to the hospital at that point. You don't really need to be waking up people that have sustained a concussion or mild TBI every single half an hour to make sure that they're still able to be aroused.
Great. And so when you were talking earlier about, sometimes people sleep too much, sometimes people sleep not enough, the sleep apnea, all those types of things, depending on what someone's sleep pattern is showing, does that also change on what they should do to support their sleep? Because I mean,
Yeah,
sometimes it's a little different, depending on what they're experiencing,
depending
but
on what the issue. Absolutely, yeah. So yes, the short answer is yes. If a person has sleep apnea comparatively to insomnia, when they're like, let's say, waking up during the night without, an apparent reason, there isn't any sort of desaturation of their oxygen levels, there isn't that stopping and breathing, then you should treat that. I would say like in the first again, month or so, this could be something that just resolves on its own. So again, if it was, some kind of something more chronic, like it's been months and you have sleep dysfunction, which it entirely is possible. There's a 2010 study I remember that we talk about in the Concussion Fix course that they found that 67% of people had disturbances in their sleep wake cycle even 3 years after sustaining a traumatic brain injury. And so this is obviously potentially persistent. And so if you've had sleep issues for longer than 3 months after a concussion, I definitely would be looking at that to get that further assessed. Talk to your family doctor, talk to your primary care provider, and then you may need to be referred to a clinic to do a sleep study. And that's where they hook you up to all the electrodes. Yes, I know it's uncomfortable, but that's really the way that we have to figure out, is there anything that's actually pathological? And then the treatment for different types of sleep disorders is quite different. So just as an example, circadian pattern maybe is more responsive to light therapy and melatonin therapy, where somebody that has hypersomnia, maybe there's some sort of stimulants, or we have to look at their endocrine HPA axis being dysfunctional, or compare that to obstructive sleep apnea, where you're looking at actually making sure that there's oxygenation and there's different devices, and then even the CPAP machine, the dreaded CPAP machine that everyone wants. But if you do have apnea, sleep apnea, Nikki, it's a huge game changer if were to correct that. So I have so many patients that wake up, they're tired, no matter what they do. They've done all the testing. Yeah, they might have had a concussion in the past, but now they're in the persistent stage, and they just can't feel energized. Well, you know what? A really common reason for that is because they're not getting enough oxygenation to their brain overnight. So that's like, 6, 8 hours of desaturation, and it's like a massive problem for energy throughout the day. And then when people correct that, it's like a light bulb turns on, and they can now have the ability to go and do their rehab and just function.
yeah. And I know you said the dreaded CPAP machine, and I've heard it from quite a few people of, they don't want to use it at first, but once they've used it and have gotten used to it, they feel the benefits, and
Yeah.
they actually start to feel better because they know that they are sleeping better, which is great. So even if you're dreading it, maybe not wanting to try it, and it's been suggested by a health provider, just give it a try. Give it a try. But the one thing we often hear is naps. So, I'm just
Mhm.
thinking back to my own experience and experience that members have posted a lot about of they maybe get 2, 3 hours of sleep a night. They fall asleep around maybe 4 in the morning. They're up at 6, 7 in the morning. Uh, and so at that point, is it okay to take naps during the day? How do you stay energized when you are going on such little sleep?
Yeah, I think that's an important distinction here is that, what phase of concussion recovery are you in? In the acute phase, absolutely, I think naps are just a coping mechanism that your brain's trying to heal itself. But if you're months or even years out and you're still napping, I think most experts would agree that that actually can be detrimental to just having a good, healthy sleep pattern. Because the reality is that if you nap, there's this molecule in your brain called adenosine, and it as it builds up during wakeful hours, it increases and it causes sleep pressure in your brain. That's the term for this buildup of adenosine, and ultimately that's what's going to make you tired and wanting to go to bed. Now you can push through that a little bit, and caffeine delays that a little bit, or the delays the buildup a little bit. But if you nap, that'll substantially decrease your adenosine, and now you're not going to really be as tired in the evenings. Now, again, acutely, your brain is still recovering. So again, in the weeks up to maybe 30 days after concussion, you can incorporate naps. But if you're relying on naps to function, that is a reliance tool, but wouldn't be surprised if it also disrupts your sleep. So the first thing that we do is we look at shortening those naps, keeping them under 20 minutes, and then ultimately weaning people off using those naps to properly function, addressing underlying issues like why does a person still need a nap? Naps are, I don't think, something that for most people are necessary. Now, I know there's sometimes cultural things, and hockey players that I've treated this like they always nap before their evening games. So there's some definite habitual and cultural things that might make that work. But I think most people living in kind of modern society, napping is not necessary, and I don't think it actually can disrupt your nighttime sleep.
What about any specific sleep positions or environments or routines? Is there anything of those that should be kept in mind?
Yeah, I mean, what you're talking about there is ultimately sleep hygiene, and we talk a lot about that, with my patients and also in the concussion fix course. Because this is the first place that you should be looking. So I mean, we can just kind of go over some of those aspects of what you just asked about, because your sleep environment really plays a huge role in the quality and even the duration of sleep. So, for example, and again, a lot of this is something that you've probably heard about, and hopefully is now more common knowledge. But you want to sleep in total darkness. And that really even means like that little nightlight that's there or that clock radio that's there can be disruptive. There's research showing in even young adults and kids, when those that had night lights or radios that were illuminated had decreased melatonin, and ultimately the light during the day sets up the melatonin production at night. But if you have light in the night or in the evening, especially screens, they're producing something called blue light. That's a shorter spectrum wavelength compared to the longer spectrum, like red lights and orange lights, those kind of more calming and kind of warm colors. They're not as stimulating, and that actually disrupts your circadian pattern. That pattern is what keeps us kind of tired at the right times and awake at the right times. And it's regulated off light, Nikki. So you have to sleep in total darkness. You want to sleep in a more cooler environment. Anybody that slept in a hot climate without air conditioning will attest to that. But that also may be applicable in some cases in air conditioned environments where it's maybe too hot, in terms of maybe you're sleeping beside a pet or a partner that's really hot and disruptive. You speaking of disruptive, that's another huge one. I ask my patients that all the time. What's your actual like sleeping situation? I had a patient this week where she was saying she's had problems sleeping all her life, and then we start digging into it. Her husband snores, and so she wakes up. She's a light sleeper, and then she can't get back to bed. And I ask her why, and she said, "Well, my husband's sawing logs beside me." And so, now that's a health issue because snoring is not normal. That's a sign that there's some sort of airflow problem, or there's an anatomical problem in the nose or throat. And that is disrupting her sleep now. And that is definitely something that can be disturbing. You can be disturbed by sounds if you're, by a highway or by a road, or you have other people that are living around. Some of that's out of your control, some of that is in your control. Things like earplugs and things like eye masks can be helpful. We have to be careful with white noise. A lot of people use these like white noise machines, especially with kids. They're actually quite loud, and they can be destructive for your nervous system and your brain, especially if they're used white when they're young and too loud. So these are types of environmental things, Nikki, that you should be considering. And that's definitely part of the sleep hygiene that we teach in the concussion fix course.
Great. Now when you were talking, what about like actual sleep position? Sometimes you hear about
Mm.
sleeping on your right, your left, and then does the pillow also matter for that position too?
Yeah, yes, you did ask that question. That's definitely part of the environment. So the short answer is absolutely the pillow and the mattress matter. So not just the covering and the temperature and the light and the being disturbed. Sometimes positioning makes a difference. So first of all, chronic anybody that's in pain is going to have an issue with the position. So you obviously want to find a position that you're the most comfortable in. Uh, Definitely, what is very clear is that stomach sleeping is the worst because you are cranking your neck off to one side and you're staying in that position for an extended period of time. It also closes up the airway, and it also seems to have the worst effect on your brain detoxification that happens overnight. This is something that a lot of people don't know about, but there's a special system in your brain called the glymphatic system. And this system is what eliminates all the wastes and byproducts that the brain is producing because it's a highly active and highly metabolic tissue. We often think about like, let's just fuel our tissues and our brains. Well, the elimination, the quote unquote kind of like garbage truck disposal service is also really important. And that happens all over our body, but it's especially important in the brain. It's actually one of the reasons that sleep deprivation is so detrimental is that there's this like toxic buildup. So all the proteins that are misfolded and all the waste accumulation from producing this energy is just kind of, it builds up and it can be toxic to the brain. So sleeping in your stomach can impair that. Side sleeping seems to be the best for that. Now, it also is pretty good for your airway. You do need to have the proper pillow for this to happen. I also think like, and this is me being a naturopath, I think about, the environment of your what you're sleeping in. So are you sleeping on synthetic sheets? Are you sleeping on cotton? Is it breathable? That's part of the temperature regulation. Is your mattress comfortable? What is it made out of? Then is it natural fibers or is it synthetic fibers that are slowly off-gassing? I know people might be like, "Whoa, Dr. Paul, you just went down like the crunchy rabbit hole there." I'm being truthful that you're spending a third of your day on this in this environment and on this mattress and pillow. You want to make sure that it's not going to be doing something low key detrimental to you. So take that for what it's worth, but definitely wanting to look into natural fibers, cottons, natural latex, bamboo rather than some of the synthetic ones.
Absolutely, absolutely. So I'm just trying to think if you could pick your top three things on how to support someone regulating their sleep when, not talking about acute concussion, but now we're in the PCS stage, what would be your top three recommendations for people?
I think we've touched on almost all of them. The first thing I would say is what's your sleep environment? What's your sleep hygiene? And so I touched on that. So sleep in darkness, sleep in a cool situation, sleep in a situation that's comfortable for you. If you have chronic sleep problems that are persisting after a concussion, don't wait to get those assessed. A lot of people that we see are just like, well, this is a problem. I'm just going to deal with it. If you can't sleep, it's hard for you to heal. It's as simple as that, Nikki. Number two, I would really look at light. And light is one that obviously we talked about, but I would really look at optimizing natural light exposure during the day. And that's actually often counterintuitive for people with persistent symptoms because light sensitivity is a real thing. And most people are throwing those sunglasses on right away or they're, like avoiding bright lights. Well, we actually want to get natural light without sunglasses in the early part of the day because that sets up the circadian pattern for the evening times. Oftentimes people will say, like during the summer months, I sleep better. Yes, it's warmer, but it also has a lot to do with the light exposure. So we have bright light in the morning when we wake up, and that turns our brain on. There's lots of research showing that. And if you are living in a place that doesn't have that, like in the winter time, for example, in Canada, where I'm based, you have to use one of those like light boxes, those quote unquote sad or happy lights that helps address that light deficiency. And that sets you up for sleep. So I would say that's like number two. And the other big one is your nervous system. And I think that a lot of times people's nervous system is hyperstimulated. They're kind of stuck in fight or flight mode. And when a person's amped up after a concussion and they're dysregulated, that's going to affect their sleep. It's going to affect their ability to get down into that deep sleep. They're going to start overthinking. Their mind's going to start racing. So I would look at working with a mental health professional. We talk about this in the concussion fix all the time. In fact, our first kind of like step in our concussion fix pyramid in the recovery process is making sure we're optimizing our mindset and addressing things like deep breathing and the vagus nerve, which helps that kind of calm ultimately nervous system regulation. So, what is your routine before bed? Are you watching screens because you want to zone out, or are you kind of getting ready for bed and getting your nervous system? So in a sense, we have to kind of almost train or retrain our nervous system to be calm during that time before bed. And that's going to set you up for having a deeper, more restful sleep. But I would say those are the top three things that everybody can do. There's lots of other things that I do with patients and treatments and supplements and herbs, but those are the three things that you can do at home, basically for free.
Yeah, which is fantastic. Like you said, we can go into all kinds of fancy things, more personalized things with the supplements, things like that. But like you said, these are three. I don't necessarily want to say simple because they sound simple, but they're not necessarily easy
Yeah.
to implement when you've never done them or you stop doing them, or it's just getting into that new routine. New routines are so hard to implement. So, maybe just start with one thing and go from there. So if it's, starting with environment, check out your environment and start with that. And once you're comfortable with that, then let's move on to the next thing of light. And then once you are getting that light in the morning every day, going for that morning walk, ditching the sunglasses. I only wear
Mhm.
sunglasses when driving, and that's just more so I can. A lot of times I'm driving when the sun is setting and it's that
Yep.
super bad glare. But I mean, I never wore sunglasses up until I was an adult, and then I started wearing them, and then I was very happy when I started ditching them again because it did make a huge difference.
Mhm.
So I don't want anyone to think that, you have to do all of these things at once. Not at all. Pick one thing and, over a few weeks, start implementing one at a time, just so that we don't become overwhelmed.
Yep. Exactly. Small little steps. And these are all things that you can absolutely do um, on your own
Mhm.
and before you need to go to the sleep study, or in a lot of cases people don't even go there. They end up getting a prescription from their doctor for sleep, and so that's a really common thing that happens immediately. And once you're on those sleep medications, I even think like doctors are now hesitant to prescribe them because they know that they're just not good for you long term. There's some habituation that happens. There's a lot of mental, emotional changes that can happen because of that. Even now, some of the cognitive changes of using these benzodiazepine drugs, which are kind of used for anti-anxiety effects, which often is one of the reasons people can't sleep. They're highly addictive and are linked to things like dementia in the long term. So these are all things that are band-aids. Not to say that they don't have a role, Nikki. I think that medications can be very helpful, but in my opinion, they're in the tip top of the pyramid. We have to address all the underlying things first. Try to address root causes if possible, regulating the nervous system, addressing airflow if that's a problem, trying some natural things and sleep hygiene, of course. And then if all those things don't work, then we go to the meds. Uh, but otherwise, we kind of might get stuck in a bit of a hamster wheel with some of these medications.
Absolutely. You want to exhaust everything first. Like you said, kind of like a pyramid where we talk a lot about a recovery pyramid. Same thing with sleep, exhaust all the foundational parts first before that part. Any parting words with our listeners?
I think that we concluded there perfectly. I think that now we have to kind of look at things from the foundation up. Don't discount the importance of some of these sleep kind of hygienic things that everyone should be kind of focused on. Just, reflect on what your sleep patterns are like after sustaining concussion. They can get dysregulated. There could be a whole bunch of different reasons. Maybe do a sleep journal or sleep diary to observe that. What days do you sleep well on or better, and what days do you sleep worse? A lot of times it's things like, you know what, I did watch that show and I didn't get a good rest of sleep. Or it's like, I had that one glass of wine and now I couldn't sleep after that. There are a lot of these disruptors in our environments, and our sleep is being constantly assaulted by a lot of these technological and even dietary things that we just have easy access to. So just addressing those things first. And then after that, you can start stepping up some of the more detailed assessments with sleep specialists. But I think we gave people a good overview of what to think about and how to address this super important factor in their concussion recovery.
Absolutely. Thank you, everyone, for listening to the Concussion Fix podcast. Remember, recovery is possible and you're not alone. Have a great day. Bye.
Bye, everybody.
Thank you for tuning in to the Concussion Fix podcast. We hope you found today's episode helpful and that it gave you a little more clarity, hope, and confidence on your road to recovery. Remember, every step you take matters, no matter how small it may seem. If you feel that you could use a little more support on your healing journey, check out the Concussion Fix program. Just visit concussiondoc.io or simply type Concussion Fix into Google and read some of the reviews from people who've already walked this path. With over 3,000 success stories and an average symptom reduction of nearly 50% in just the first few weeks, it might just be the help you need to break through. Thank you again for listening. If you found value in this episode, please share it with someone you think could benefit, and don't forget to subscribe so you never miss a session. Until next time, stay hopeful, stay curious, and continuously remind yourself that recovery is possible.